Hello, I'm Mark Ells, Barnstable Town Manager, and I'm here to provide you with this week's community update. Well, we continue to manage this COVID situation, and though the governor continues to modify as we progress through it his orders of directives, and we continue to follow those, the focus is clearly on vaccination. We provided our town council last evening an update relevant to our progress. Town of Barnstable and its staff are an active part of this phase one vaccination that's occurring. And I would encourage you all to go to mass.gov and take a look at what the vaccination plan is and when you might be vaccinated. Basically, it's a three-phase plan. It started in December, and it's expected to continue through April. And we are in phase one of this plan. Phase one is certainly has specific categories of individuals that are being vaccinated at this point. We are doing it locally for a portion. And there are other entities, both county, state, and private, that are also participating. And they will in phase one, and in phase two, and in phase three. We hope to see phase one completed by early February. And we hope to see phase two commence in mid February. All of this is contingent upon supply of vaccine. Town of Barnstable does not control supply of vaccine. It is our understanding that throughout the Commonwealth, they will not proceed into phase two until everyone has completed phase one. And again, we are in phase one. We have not completed it yet. So following this town manager community update, I'm going to provide the update that our assistant town manager, Andy Clyburn, provided to our town council. I'm also going to encourage you, if you have time, to go into our website and to take a look at the town council meeting under town manager communication so that you can see the full discussion after the presentation by assistant town manager Clyburn. And I think it'll be a benefit to you. I also have to encourage you, if you have questions as to how this is progressing, please go to mass.gov. Right away over on the right, you'll see COVID, click on it, and there is all sorts of information that you can access, including the modifications that the governor made to his orders yesterday. And these are continual, so you need to look daily to understand where we are on any and all issues related to this. And again, Barnstable is following these orders and directives of our governor. In general, though, please continue to wear your face mask. Continue to follow the proper protocols like, washing your hands, maintaining proper physical distancing. And when you're sick, stay home from work, school. Don't go to your sports or other activities where you may carry potential COVID, or even more generally, you may expose people during this event. It's really important. Until the vaccines are administered, this is our front line of defense. This will continue well through 21. So everybody's fatigued from this, but please look at what's occurring as far as our governor's orders and directives. Maintain the protocols to protect us, and we will do our best to inform you as we better understand when we will receive the vaccine. We are ready to administer it. So be assured of that. Whatever portion of a phase one, two, or three that we are allowed to proceed with, we will be ready to do that. And we will do our best to continue to communicate with you. Secondly, we're moving into budget season. And if you have a chance to view town council Last night, the town council and the school committee met, and Mark Milne laid out where we are relevant to current budgets, but more interestingly, how we will proceed into next fiscal year, where our revenue projections are. I think it was well presented. And if you have the time to view that, I would recommend that you do so. We will be discussing budget more in the next 2 months and ultimately submitting a proposed budget for FY22, submitting it in March, beginning review of the capital in April, beginning review of the operating budget in June. Finally, we continue to progress with our comprehensive wastewater management plan. And last night, I gave an update relevant to the fiscal policy discussions we're having. And Director Santos from our Department of Public Works gave an update on the technical and regulatory side of it. We've achieved a tremendous, we've achieved approval from the Mass Environmental Protection Act. And that's a major hurdle in proceeding with a comprehensive wastewater management plan. Basically, you receive a certificate from them that says you're good to go with your plan. And this is where all the various agencies review what we've put together in Barnstable and have questions, we answer them, and then ultimately you receive a certificate. So that we have achieved that, and we're moving through the final steps from a regulatory standpoint. As we've discussed before, the town council has approved funds, and we plan to begin construction of pump stations and sewers in calendar year 21. It's very important that every citizen in Barnstable and every business in Barnstable follow the upcoming discussions of fiscal policy. We're going to hold public engagement discussions second week of February. We're going to do it during the day and in the evening, and then the second week of March, day and evening, so that we can try to engage as many people as possible. We're also going to be sending you communications through as many channels as we can, whether it's on channel 18, whether it's through, whether it's posted on our website, and we will have a new button on our website called Water Quality. And within that, all the information relevant to this comprehensive wastewater management plan effort will reside. So a resident will very easily be, much like if you go on our website right now on the homepage and you see COVID, you can click on that and it takes you into all sorts of information, whether it's ours or county or state or other, the same thing will exist for this effort. We're going to send direct mailings. We're going to utilize our newsletter. We're going to email you. We may even do direct mailings to every resident. This isn't just a small group of people that are going to receive sewer. This is a discussion about quality of life in the town of Barnstable and how we plan over the next 30 years to protect our water resources. And every citizen and every business needs to engage in this, because we're going to ask you to participate in it from a technical, from a regulatory, from a financial, and the basis of this is maintaining these water resources so that we maintain quality of life in the town of Barnstable. This is a long-term effort. I ask you to take the time to ask questions, to engage. We'll try to give you every opportunity that's convenient for you to do so, and I will continue to update as I do these weekly community updates. So I thank you for listening, and I look forward to hearing from you in the future. Stay well.
I'm Assistant Town Manager Andy Clyburn, here to give an update on COVID-19 vaccinations. Before I begin, I want to state the obvious. Whatever I cover tonight will change. Anyone that watched the evening news tonight knows that there will be an effort to federalize a portion of this. But with that said, I would like to go ahead and give you a sense of where we're at locally in context with the county Commonwealth. So I'm going to take a moment and hopefully share my screen with you. Okay, that should be the Town of Barnstable website. Does everyone see that? All right, great. That's our starting point. So as you likely know, the Commonwealth of Massachusetts has a three-phase plan governing the COVID-19 vaccination rollout in the state. I'm going to briefly walk you through the graphic provided by DPH that outlines the various phases, but I thought it would be good to kind of walk through so people can see how to get there on their own. So if you go to the Town of Barnstable website and you click COVID updates, that brings you to our Town of Barnstable health site. A lot of good information here. The graphic that I'm going to go through is here. I'm just going to take one moment to say, if you want vaccine information, click on this and it will bring you to the county health website, which is also a very good site, great information. Of note that they have established a COVID-19 helpline for the community, 774-330-3001. We're grateful for that. I do want to note they are not asking people to call in to create a list. There is no current quote unquote list being developed for vaccination, but you can feel free to call in periodically, see any updates of where you land with the various phases and who is eligible for vaccination. So with that, you'll see on the graphic, phase 1 vaccination includes healthcare workers doing direct COVID care, long-term care facilities, rest homes and assisted living facilities, first responders, congregate care facilities, including corrections and shelters, home healthcare staff, and other healthcare workers doing non-COVID care. You can see at the bottom of this graphic, it gives you a rough timeline, basically starting in December, running through June, with phase 1 being through February. Then we enter phase 2, which should go through April, and hopefully phase 3, April through. The second graphic here gives a little more detail on the phase 1 timing by group. As you'll see, each of the various groups that are in phase 1 are listed on the left, and it actually goes into a weekly timeline. This has not yet been developed for phase 2. So to put this in perspective a bit, our local health and public safety departments were initially tasked with vaccinating the first responder of piece of phase 1. We've done that. We're now looking with our partners to address the remaining phase 1 eligible population, basically congregate care and home-based non-COVID facing healthcare workers. And the last of these two actually were just authorized to start today. So the most current information. While we're anxiously awaiting the completion of phase 1, it's important to know that we cannot start phase 2 vaccinations or even order phase 2 vaccine until the state allows us to do so. Our hope is that we will proceed as currently projected by mid-February to start phase 2. At this time, we do not have any guidance in terms of what will be determined, what they will use to determine the start of phase 2. We do know that the state does not want any community to move into the next phase of the rollout until the entire state moves into it. They've been very clear in our weekly brief. Foot stomping on that. So right now, planning is underway to ensure the timely, equitable vaccination of vaccine as supplies arrive. We're confident that any and all vaccine that the state sends to us will be administered as soon as possible. There will likely be multiple paths to vaccination, and we are encouraging everyone to pursue whichever path works best for their personal situation as soon as they become vaccine eligible. Those multiple paths may include state-run mass vaccination clinics, county drive-through sites, Cape Cod healthcare primary practices, local pharmacies, and again, our local health division. And as of tonight, possibly even a federal participation. As we receive information and guidance from the state authorities, we believe that the local focus could end up being fixed sites and mobile distribution to targeted areas, particularly those areas without easy access to transportation or other paths to vaccination. Some scenarios we've developed include holding multiple concurrent vaccination clinics. Phase 2 implementation will clearly be very impactful in Barnstable. It should encompass over a third of our population. Should the phase 2 rollout continue in a similar fashion to how they did phase 1, there'll likely be priority orders within the phase, much as they did a week by week prioritization of the 6 in phase 1. Likely we'll see something similar in phase 2. So it could be, right out of the chute, we're allowed to do 75 and over and our educators. And then move on to the remaining categories later in the. We're just awaiting that guidance at this point. We don't have it. But to put the context on the numbers on this, for phase 2, we've got about 6,000 citizens over the age of 75, 800 plus educators, 7,500 citizens between the ages of 65 and 74, and then thousands of food service, grocery, sanitation, public works, etc. So you can see quickly phase 2 could get to that number of between 15 and 20,000. Seems like a lot, but it's manageable. It's very manageable. We completed our first responders within 3 days of receiving the vaccine. We're committed to the same sense of efficiency and urgency throughout this entire process. I really think it's going to be a supply issue. I want to wrap up by assuring you that we will share all pertinent information as it becomes available. And even more importantly, we won't be a choke point. Quite the opposite. A finely run operation that vaccinates all of our allocated doses with great efficiency. Our community is very fortunate to be staffed with consummate professionals who are prepared and eager to tackle this challenge. Finally, the town of Barnstable has a robust multi-department planning section that's been diligently working on this. Tom McKean, Chief Burke, the list goes on and on. I won't try and name them all, but they're in constant communication internally, as well as with all of our local and state partners. Very optimistic that the only limiting factor, as I said, is going to be our supply of vaccine. DPH is committed to getting it out as quickly as they can, but they're in a tough spot as well with the ongoing shortage. President Biden has said 100 million vaccines in the first 100 days. Hopefully we'll be significantly more than that. But until we get that supply, we ask folks to remain patient, stay safe.